My name is Dr. David Bass, and I'm going to introduce you to the Antalgic Trak, which is this device here, which I invented several years ago and have gone through several renovations of the product to come to this final version, which is called the Antalgic Trak Robotic ATT Prime. The Prime has a number of features on it, including the ability to treat the cervical spine and the lumbar spine. All the mechanisms of the machine are controlled by a touch screen, which has manual features on it, as well as touchscreen features. The most advanced feature of this machine is that the cervical headpiece, or part that treats the neck, and the lumbar treatment section articulate, which means they rotate, they flex left and right, they flex forward and backward, they translate, giving us a total of 10 different directions of motion, including the decompression or traction. Okay, so now we've got Valerie harnessed and ready to go onto the table. So you're going to take your left hand, place it on this cushion, step up on the gray platform, sit, and then swing forward like you're getting into your car. And then we're going to raise the seat as high as it can go. And then we'll connect the harnessing and set up the decompression. Okay, I now have Valerie harnessed into the table. We've got the pelvic strap holding the pelvis to the seat, and we have the thoracic strap holding the rib cage and upper body to the top of the machine. I come over to my screen and I can choose on this machine when we do lumbar therapy whether we're going to set up the parameters by poundage or force, or whether we're going to set the parameters by distance or stroke. This is a very key difference between every machine in the world. This is the only machine that we can set up the treatment parameters by distance. So in case we have a geriatric or a post-surgical and we want to limit how far the machine will decompress, we can set up by distance. Today I'm going to set up by force, and so I'm going to clear out my last session, and now I'm ready to just distract the seat downward, and we can see the poundage starts to come up. As we distract, I'm going to translate the seat a little bit forward to raise the pelvis off the seat back. I'm going to teach this poundage force. I'm going to release the poundage. I'm going to teach it. I'm going to go to a therapy screen. I'm going to set my time. In this case, we'll just do a 10-minute. And I'm going to bring the time down, or the dwell time, which I will explain momentarily, to 3 seconds of pull and 2 seconds of release. I use those settings to test the pull and the release. So now I'm pulling for 3 seconds, I'm releasing for 2 seconds, and that's where I can modify or change my poundage parameters without having to wait for 30 or 45 seconds and 10 or 15 seconds on the rest. So here I can see I'm pulling at 100 pounds, I'm releasing to 60 pounds, and then my therapy might be actually 30 seconds of pull and 10 seconds of release. And that will continue for the time setting, and then the machine will automatically stop and bring the table back to neutral. And that's a lumbar treatment setting. Now, while we're treating, we might want to use some articulation. So as the machine is pulling, and right now we're at a rest for the 10 seconds, while it's pulling, I will just lower the seat a small amount, and that stops the timer, or stops the cycling, but keeps the timer moving, and I will demonstrate some rotation. So while the spine is distracted, we can now rotate from 0 to 90 degrees per side. And what this does is it changes the orientation of the lumbar facets, which are the gliding surfaces. And it also changes how the pull force moves through the spine. So anytime you change the patient's posture, you're adjusting how the pull force moves through the spine. This table also has the ability to flex and extend. So I can bring the knees towards the chest, or I can bring the feet down towards the floor and create some lordosis. So if a patient has lots of osteoarthritis in the facets, you can limit the pull force by increasing the lordosis. We also have the ability to laterally flex 35 to 40 degrees on each side, depending on what the pelvic distortion or lateral curvatures look like. And then we just hit the resume button. It will count where it is in the cycling, and it will begin to pull and release again. Once the session is finished, the machine will beep, return to neutral, and we will just bring the table upright and take the patient off. So now we have the Antalgic Trak set up for a lumbar session. We're going to now switch the table out into a cervical session. So we're going to move these thoracic strap hangers out of the way with the scapula pads. We do that on each side. We're going to replace the lumbar headpiece with the cervical headpiece, which is made out of injected silicone. And then we'll simply lower the headpiece and we'll be ready for a cervical session. Okay, so now we're going to do a cervical setup. I have Clyde sitting in the machine. We have the cervical headpiece in place. I'll ask Clyde to just lean his head backward. He's touching the cradle. He's not quite in it yet, but when we recline him, his body weight will shift. He'll fall into the cradle, and then we'll do the rest of the cervical setup. I go once again to my touch screen. I go into my cervical therapy selection. I'm going to set it up with a distance setting. I'm clearing out my last session. And I'm going to now raise the headpiece. And we see we have a poundage reading. I'm going to raise a drop more. And I'm going to teach that amount of pull. Then I'm going to release and teach. I'm going into my therapy screen. I'll set it for 10 minutes. And I'm going to bring my dwell time, which is how long the pull is and how long the release is, to 3 seconds and 2 seconds, so I can check my parameters. I hit my start button. The machine decompresses and relaxes. Is that a comfortable amount? I'll raise the poundage by lengthening the distance. I can do that on the fly by just hitting the plus or minus button. And then for demonstration purposes, I will set this for 10 seconds of pull and 5 seconds of release. So now he's being held in decompression or traction for 10 seconds. Give the body a chance to relax, and then it's going to release for 5 seconds. To hydrate the perimeter of the disc, we want to pull and decompress for somewhere approximately 30 to 40 seconds and relax for 10 to 15. It's that 30 to 40 seconds of holding time that creates a disc vacuum to draw in fluids from the perimeter into the disc, which might be desiccated or dried or compressed or bulging. And as this is cycling, if we wanted to, for whatever the reason, we'd stop the cycling by just adding a quick movement with a manual button. Timer is still working, and we'll go through some of the movements here. We have cervical rotation. And this will rotate about 60 degrees either way. This is about 10 degrees of rotation. This helps with the facet, and it also changes how the pull force moves through the spine. We have a pull pin and a clamp for all the articulations. We also have lateral. So for instance, if he had a pinched nerve on the left, we might want to laterally flex to the right and do our therapy in that posture till we can get him to the point where we can bring him back to neutral. And if he had a loss of lordosis or neck curve, we can put him into lordosis or flexion for 40 degrees extension or flexion, which is a nice amount, which you'll probably never need the full amount, but we make it available. And then once we've done our articulations, we go back to the touch screen, hit our resume button, table counts where it was and just continues to cycle until it's complete.
The most preferred preference from the patients is that they can just go ahead and sit down on it. When people have typically some serious lumbar disc bulges or herniations, they have a very difficult time in managing to lie down or turn over on their back when they've just hobbled into your office. With the Antalgic Trak, they can just turn and sit, comfortably lean back, and then we can recline the chair and begin the proceedings to strap them in and begin the decompression. So it's much more comfortable for the patient. You can keep them in that position of decompression for a much longer period of time because it is more comfortable. And you have the ability to go ahead and change from the cervical to the lumbar in a very quick period of time. And the settings are quick and easy to learn for your staff, so you can train your staff members to set people up and begin the programs on their own.
In today's treatment environment, insurance environment, it's not only essential to have a device that's clinically superior in its results and its technological features, it also is a device that has a unique marketing presence where patients who come into your clinic will look at the Antalgic Trak, Robotic ATT, and they will know that they've never had this type of treatment before, and they are prepared to move forward with this type of treatment program, and even more prepared in the event they don't have coverage to pay cash. We invite you to see the Robotic ATT in person, experience a demo, and see for yourself how the Robotic ATT Antalgic Trak is the most sophisticated machine of its kind for generations to come. I'm Dr. David Bass. Welcome to the Robotic ATT.